Hello and welcome back to my YouTube channel. How have you been? It is the second last day of August, I think. Yeah, something of that sort. So thank you so much for the support that you guys have shown my parents during this month that I got to host my parents. Unfortunately, we never got to host my brother because I was not in a position to kidnap him for him to do that video on my behalf. So we will have to do it another time. We are finishing August and also finishing my birthday month, which feels a little bit sad, but yeah, it's okay. We live to see another birthday next year, okay? So thank you guys for being with me throughout the month, and my parents say thank you so much. They now feel famous, that we will discuss another day. But this week's video is not my video. It is a sponsored video by AidsmapWOMEN. AidsmapWOMEN is an organization based in the UK that reached out to me, and they have done a series of videos for women living with HIV. And I thought it's okay for me to support them too, so that we can be able to reach the message out there. Remember, the goal is to end HIV and AIDS stigma. And as we know that more women are living with HIV in the world than men, and we want to know why. What are some of the issues that are affecting women living and affected with HIV? Why are more women susceptible English inaenda susceptible to getting infected with HIV than men? So guys, it's a little bit of a long video, but kindly watch it till the end and let me know what you think.
Hello everyone, hello and welcome to AidsmapWOMEN. This broadcast has been kindly sponsored by Gilead Sciences. My name's Susan Cole and I'm thrilled to be joined by some extraordinary women for this broadcast about women living with HIV, particularly during the COVID crisis. I would like to introduce to you some of our amazing guests. First of all, Fungi Morale. Hi, Fungi.
Hi,
welcome.
Susan.
How are you doing today?
I am doing great, thank you. How about you?
Yeah, I'm great, thank you. So, Fungi, you're a very passionate researcher and advocate for women living with HIV. Fungi, what are you most looking forward to for when the lockdown ends?
I am really looking forward to hugs. You know, those nice, long, warm hugs with loved ones and friends, the way we breathe
Absolutely.
each other, that I'm looking forward to that.
Me too. I hope that I'll be able to give you a really big hug soon when we're through
Yes,
this.
I'm looking forward to that. I'll hold you to it, Susan.
Next, we have Dr. Vanessa Appiah, a consultant in HIV and sexual health at Bart's Hospital. How are you today, Vanessa?
I'm really well, Susan. How are you?
Yeah, I'm good. I'm a little bit stressed by the technical challenges that we've been having, but that's fine.
Yeah.
So what have you been missing the most during this lockdown?
So I should say something really altruistic, but one of the things I've really missed is shopping, and shopping by myself, trying to assess which dresses I can get and I can fit to and I can't, all that kind of rumination that you can't do by shopping online. So I'm looking forward to that.
Fantastic. Yeah, me too. Don't tell anyone, but I'm really missing McDonald's as well.
I'll move you there.
Yeah. So hopefully that's going to come back soon. Next, I'd like to introduce Josh, who is very much at the heart of the HIV response, as doing the communications for the British HIV Association and co-chair of the women's charity, the Sophia Forum. How are you doing today, Joe?
I'm absolutely fine, Susan, like yourself.
Fantastic. So, Joe, in a few days' time, on Monday, I believe, the lockdown's going to be loosened a little bit, and we're going to be able to invite up to 5 people into our garden. So, in the ideal world, Joe, who would be your dream guests for a garden barbecue?
My daughter Freddie, my best friend Jude, a nice young man in shorts to do the barbecue. It's a sort of boy thing. They're really good at that. Stormzy, because he's ever so interesting. And you, of course.
Oh, fantastic. Well, I would be very much looking forward to that. And let's get Stormzy sorted out if he's watching. Stormzy, you could actually wear the shorts and do the barbecuing for us. So thanks very much. The next guest that I'm absolutely thrilled to have on is Charity Narendra. Hi, Charity.
Hi, Susan.
How are you doing today?
I'm doing all right, apart from the technical issue I've been having. I'm making the meeting late. Yeah, sorry.
Yeah, don't worry about it. It's amazing to have you on. If people don't know Charity, she's an extraordinary activist and advocate for women living with HIV. You've also been awarded Volunteer of the Year.
Yes.
Have you? As well?
Yes. Volunteer of the Year is yes.
So Charity, what's the one thing that you have stopped really caring about during the lockdown? For me, it's shaving my legs.
Oh my God. If I've abandoned the bra. It's only today. Today I'm wearing it, yeah. But since I've not been wearing the bra.
Excellent.
And lipstick, I put it on today.
Yeah, I think we can all relate to that. Mostly, yeah. I've had lots of meetings or in my pajama bottoms. So yes, yeah, I can definitely relate to that. So, for my first question, I like to bring everyone on for this. There are a lot of issues that work together that affect women living with HIV. I know sometimes we refer to that as intersectionality. Fungi, what would you say are some of the most important issues at the moment during this crisis for women living with HIV that intersect?
I think one of the things that we're finding is that women are missing the support that they would get through group support, peer support, and it is leaving them very isolated, because mostly that is the one activity that they look forward to, either weekly, bi-weekly, or however often they go to their support groups. And then again, supporting women that are undocumented, women living with HIV, they become very reluctant to even engage in care, because they think that the authorities are on behind them and they'll be put into detention centers. And while a lot of peer support, group support, and even clinical support has gone virtually, we're finding that there are quite a few women that have got literacy problems, so it becomes very difficult for them to even engage in the virtual world. So these are the things that we're finding out, but mainly it's the isolation, the worry, and missing that contact with peers.
And is that what you're hearing, Joe, in your work with Viva?
Most definitely, it's a reflection of what Fungi has just been saying. Knowledge is power, and one of the things I found is that HIV is scary. COVID-19 is even scarier. And there is so little information and evidence about it as yet. So what we've been trying to do is to share as much information as we can, as widely as we can, through peer support groups. But that does assume, as Fungi said, that it can be done virtually in one way or the other. But of concern, and I know I won't be the only person to have picked this up, domestic abuse has been increasing very frighteningly. Refuge, which is a support society for women suffering from domestic abuse, has said that its website has had more than 950% increase in visits, 950%. And 3 times more women have been killed by men since the pandemic began. And worldwide, the United Nations Population Fund says that it expects that there could be 31 million more cases of domestic abuse. It's always there, but this is just making it so much worse.
Absolutely, that's absolutely shocking. And women living with HIV are at increased risk of domestic abuse.
Yeah.
So, Vanessa, what advice would you give to women living with HIV who may be in this situation at the moment?
Well, I think one of the things that we are really aware of, that whether living with HIV or not, in the era of COVID, it's the fact of safety and being within the home and being unable to go out to seek the help that you would normally do. So whereas people would normally go to a refuge centre or to a charity, they've been unable to do that. So what I would advise is that there are a number of virtual offerings, so both online and telephone. Now, telephone, we're also always really aware that it can be quite difficult to have those private conversations as well. And so you've got the National Domestic Violence Helpline, but also online, there are a number of sources. So there's a Women's Aid online service, which you can access information and locally relevant information. And there's a really good app by Hestia, which is called Bright Sky, and it's got a lovely interface, nondescript, and I'd also advise women to use that as well for added information, because we're really aware that safety is of really significant concern, and there are a number of online and telephone resources available. So do look for those. Victim Support, National Domestic Helpline, Hestia's Bright Sky app, and Women's Aid online.
Okay, brilliant. That's really helpful. I know usually women will be able to go to their clinic and talk about some of these issues. Obviously, during the pandemic, people aren't able to really get to the clinic. I just wonder, Charity, what's your experience been in terms of talking to your clinic and getting your usual care at the moment?
Oh, okay. I personally am just concerned about the reduced access of care and medication, because at the moment I need medication. I'm worried that I will run out, and already I only have like 2 weeks of medication. I had called last month so that I can make an appointment to get the medication. Or what I was told was I should make an appointment, which I did. And I've called their clinic twice so far, and I still haven't heard from them. All what I got was a text telling me that I have to wait until I've got 2 weeks of medication, and somebody will call me.
And Joe, in terms of your work with Beaver, are you hearing issues like that from people?
Yes, I've actually been getting a lot of calls from people who are either just people living with HIV, like myself in the community, but people living with HIV who could be nurses or pharmacists. They found my number online, and they simply found it impossible to phone and get through to their clinic. And we know that the capacity of clinics has been reduced. It is coming back up again now. But it obviously is going to make people extremely worried. I've had a virtual appointment myself, which was by telephone, because there is another issue, which is that a lot of clinics don't actually have camera-enabled computers. So they couldn't do a virtual consultation with someone, even if that person had the technology to do it themselves. For some people, it will work fine, and it will get carried through into the future as a way of using time well.
What would you recommend, Vanessa?
So I think one thing that Joe's alluded to is that, yes, very early on within COVID, it was something completely new, and capacity went down significantly. And every clinic had to really, really rethink the way that they were delivering services. So if I use our service for an example, we moved significantly onto virtual, telephone, and we're now moving on to video consultations. But getting those processes in has taken time. It's taken time to embed them. And it's not surprising, but it is unacceptable that some people do fall through the gaps. And so I think that clinics are really aware of this, and a number of policies have been put into place to really try and find those people that have maybe slipped through the gaps to support them. And I think also I've been hearing about people finding quite creative ways about getting in touch with the clinic. So if they've called and they can't get through, they've sometimes gone onto social media and directly DM'd the clinic to say, look, I need some help. And I think in this day and age, through COVID, that's what we're seeing. We're seeing really creative responses, and it isn't ideal. But what I will say is that I think as time goes on, clinics are really going to be there and strengthening capacity to support everyone in the way that we normally have.
Yeah. Thank you. And yeah, I do think that we're all being really creative in the way that we're communicating, and also like just dealing with issues. Like Charity, I know it's been a bit of an issue for you in terms of the lockdown and being on your own. I mean, what has helped you cope?
Oh, wow. It's been, firstly, I would say it's been a very difficult time for me and everyone else. But, living on your own, it's not good at all. But what has been really helpful for me is talking to my friends on FaceTime once a week. We check on each other, and we talk about what we are going through. And the other thing which has really helped me as well is I'm doing things which I've never done before. We have a park near my house, and I walk. I do the early mornings. I do 1 hour walking, and I found that I've noticed that I've found amazing things which I've never seen before, which I didn't know we had. Like we have parrots in the park. We have deers. I've never seen them before, so everything was new to me. Yeah, and doing social. I remember at one point I did a session on making masks with women living with HIV, and when I did that, I was so happy. Like for 2 days, I was just buzzing.
Oh, fantastic.
I have one of Charity's masks. They are brilliant. Yeah.
Joe, what's it like for you living on your own? I think you've been pretty much isolated for is it coming up to 3 months now?
It seems longer. But yes, because I actually had COVID-19 in February, so I've been alone for longer than the rest of the country. But I mean, now I can get out, very much like Charity. I walk around, in my case, the commons and the parks, and go, oh, I saw a nuthatch today. And I talk to people who are walking dogs, because dogs always come and say hello to me. So I talk to their owners. And I have been helpless. I have had to correct some people about their misapprehensions about COVID-19 because there's been so much fake news going about. And I've sort of taken the opportunity to mention HIV. I said, well, actually, I know quite a lot about it. You see, I work in infectious diseases. So, and then I've talked about HIV. And if I say that with HIV, you're no more or less likely to get COVID-19 or suffer it badly than anyone else in the population, they go, how interesting.
Yeah, I think that's it's so helpful, I think, to know that people living with HIV on effective treatment aren't at any increased risk. However, I know a concern for lots of people, particularly from Black and Asian communities, is the fact that Black people seem to be so much more likely to be affected adversely by COVID, and that's, I think, having a real issue. What are people worried about that? What's been your experience as a healthcare professional in terms of coming from a community?
So I think. So from my point of view, obviously being Black myself and working in healthcare, I've seen it from both angles. So on a personal level, when the data started to come out, you can feel the anxiety, not only within yourself, but within your family and friends, and it's palpable, and just adds to the fear of it. And for a personal impact of it was that as part of our redeployment with sexual health and HIV teams, we were redeployed to the COVID wards in our hospitals. And at that point, so I live with 2 young children and my parents are both over 75. And you have that fear thinking, right, I don't want to be the one to possibly be bringing COVID into the house. So what do you do? And COVID's bad enough, but if you're saying that in our communities it's far worse, then you have that added burden. So I personally had to move out while I was on the wards as well, and you can imagine that effect on personally and my family as well. But as a healthcare professional, a predominant percentage of staff within NHS are from BME backgrounds. And so you then also started to see that impact within staff themselves. You started to see the data of every statistic that was coming out when we unfortunately lost someone to COVID within the healthcare profession. And you would see that the significant proportion were BME. And I think that was really scary. And it was scary for everyone, not just for those communities, just everyone, because we didn't understand it and we still don't understand it. And no one likes to feel that you're handling something that you don't understand. So I think it's been difficult, but people are rising to it. But I think we have to be really aware of the physical and psychological impact that has to our communities.
Absolutely. And Fungi, I mean, what's it like in terms of actually being in lockdown with children?
Oh my goodness. I've done many things in my life, but I think this has been the biggest challenge yet. I have a 16-year-old who is asthmatic. And so we've been shielding for 11 weeks now. And then I've got a 6-year-old who is just, I think, powered on jet fuel. So she needs to constantly be entertained as well. So trying to find that balance between the two of them, their needs, has been enormously difficult. But I think we have prepared ourselves as a team. So we kind of say, okay, team, what are we going to do? And my 16-year-old had and I think it's with a lot of children, the traumatic experience of suddenly not being told that she can take her GCSEs, and she's been studying really hard for that, and to now sort of be told she's going to be given a predicted grade meant that I sort of had to rise to the occasion to be a counselor, friend, to listen and to say it will be okay. And then the 6-year-old also with homeschooling. That has been, we were really good for the first 5 weeks. I think she was the star student until it got to a point where I just thought, I'm not a school teacher. I need to be kind to myself and say, if we bake a cake and I tell her that we've used 100 grams of butter, she's learned something. And so we started taking our lessons with my 6-year-old to more practical things. Yeah. And we're quite lucky that we've got a garden, so I can open the doors and they can get get some sun and run around a little bit. But even with me, I'm quite active, and not being able to go to the gym or anything has been a real challenge because I can't leave them on their own and the gym's closed. I can't even go for a run like all my other friends. But I've been jogging in the garden, which has helped. And I find that it's become, and if I say to the girls, Mummy just needs 5 minutes, they're actually really understanding, even saying to them today, Mummy's going to be doing this recording. Can you give Mummy the Wi-Fi? And they were really understanding, but it is a huge challenge. And I have to salute all the people that are looking after children during this lockdown. It is difficult.
Absolutely. And I think it's really important what you were saying about self-care. And I just wonder what everyone's doing to take care of themselves in terms of their well-being, both physically and emotionally.
I went and sat on Earlswood Common, which, if you don't know Earlswood Common, is somewhere in between London and Gatwick Airport, with my best friend Jude for 3 hours when we could actually do that. We just talked and talked. We weren't so much catching up. It was just talking about everything, what we didn't like, what we did like, how we were getting on, and so on. And it's okay talking on WhatsApp or on Zoom, but it just ain't the same. But next time, maybe we might have a drink as well.
Yeah, that'd be wonderful. What else are people doing just to take care of themselves?
My bath is my sanctuary, so it's late night, candles, anything nice in there, and put Netflix on. I'm terrible, so I have it on, and I just have that peace, be it from 9 till 10 p.m. and just kids are down, the day has ended at work, wind down, watch anything on Netflix. Doesn't have to be intellectual. Shouldn't be intellectual, and just relax. And that's been my kind of solace. Yeah.
Fantastic.
I've actually I've joined a book club.
Ah, wow.
Well, I was introduced to it a number of months ago. Yeah, before lockdown, I was introduced to it, and I kind of just thought, I'm too busy. I've got this, I've got that. And then I thought, actually, I'm not that busy anymore. And so I've joined a book club, and we have our call on Sunday to discuss the book.
Fantastic.
Wow.
Yeah.
I've also just joined the book club, and my book, which they recommended, just arrived yesterday. And apart from that, my self-care, I just keep on sewing. Whatever I imagine, I keep on sewing. But at times I do get bored. But last week I tried something else. Like I said earlier on, or during my walks, I saw these amazing things. I ended up in a cemetery. Then I decided to go and see this cemetery. And I sat there for a good 20 minutes. It was so beautiful.
Fantastic.
So I might go there next week.
Unusual, but yeah.
There's all these trees, there's so many people in that cemetery. And I'm like, how come I've never seen this?
Some of them are alive.
So I keep saying, somehow lockdown has been good to the nature, and but it's sad that we've lost so many people. But
that's so awful. But do you think that in some ways, lockdown is helping you, discover things that you didn't know before, like cemeteries?
Oh, definitely. Oh my God, definitely. I've spoken to strangers like you, Joe. I've seen my neighbors come to the door. I'm like, what? This has never happened on my street. So
brilliant.
My neighbours are all talking to each other as well. And it's really nice because people are just accepting each other as they are. There's no judgment call or anything. But the other thing, like charity, but not actually in a graveyard, is I find looking at nature, just looking at things and seeing the changes, because I've really watched spring happen and change, from blossom to leaves and so on this year. So much more than I probably ever have done.
Oh, that's brilliant. One of the issues that some women living with HIV have raised with me is the fact that the COVID pandemic has really been quite triggering in terms of memories of their own diagnosis, and has also sort of bringing back mental health concerns that they thought had been addressed. Is that something that anyone has experienced or have heard about other women living with HIV being affected in that way?
This just, I think I've not heard anyone, but at the beginning I did feel like this feels like HIV, when you are newly diagnosed.
I think that it's scary. The fact that it is scary is what does trigger feelings and so on, because everybody living with HIV, all right, okay, maybe I'm speaking for me and people I know, is to a certain extent at least still worried about it. What will happen as I get older? Are there things that haven't yet been discovered that will affect me? Is my brain going to go? Which is something that we all worry about. And COVID, because it's everywhere. It's like illness is everywhere. Every news broadcast, every newspaper, everything is making you very conscious of yourself, of your body and your own health.
Absolutely.
I think that's really powerful, Jo, because I think that what we're seeing in clinics, so those patients that have perhaps disengaged from care and they've been perhaps engaging in peer support but not coming to clinical services, I've seen quite an increase in people coming back and calling in. And I think it has been triggering. And I think people have that kind of anxiety about what is my place in all of this? I'm already dealing with something that I'm finding difficult to manage day to day. And then I've got this added layer, and where do I fit into that? And I think that people, COVID is scary within itself, but what's scarier is that I think loads of people assumed that if you were living with HIV, that the outcomes would be worse for you. So the fact that it isn't, I think some people are also thinking, is this right? Do we really understand the data properly? Can we trust it? And I think that lack of trust is very similar to early days in HIV as well. So I think there's lots of different emotions that are coming out related to it. Yeah, definitely.
I've been asked so many times if something really simple and reassuring could not be said. And so many statements have been produced saying that there is no evidence to suggest that it's worse in any way for people with HIV. But people don't believe it.
No.
And I don't blame them.
No.
Absolutely do not blame them, because this is so new. Therefore, we have so little information, don't we, at the moment? And we grab everything. Research studies that actually feature 9 people, are published without being peer reviewed, and people are taking them seriously. Incidentally, none of them were women.
Yeah.
I wrote that. I personally was comparing the two, like the vulnerability of sickness and death, the COVID and the HIV, and then the fear of loss of loved ones, and also the fear of spreading the disease. I was just comparing the two, and it just made me worry when I think about the information, misinformation about what was coming online on social media. That is the one which scared me most. And I was just lucky that I had friends who were supporting me, because anything would trigger, and I'll be at my low level of feeling.
Absolutely. What else, Fungi, in terms of the women that you've been supporting, what else are they sharing?
I think the one thing that especially women we went through this very wonderful time of celebrating You Equals You. And we were waving our flags saying we can date and have sex and not worry about passing on HIV to our sexual partners. But what's happened now is suddenly women have now had the confidence to join dating apps, to meet people. And now with COVID, all that has been taken away. So it's almost one woman said to me, it's almost as if I'm being punished again. When I got HIV, I was punished that I couldn't. During that time, she was advised not to have a child, not to date, not to have sex. It was just, then she said, I just feel now that I've paid my precious money to join a dating site, I can't even see these guys and I can't even have sex. So it's just like being punished all over again. So that's another thing. And I know there are quite some good messages that are coming about, self-pleasure and things like that. But I haven't seen any that have been aimed at women.
So I completely agree with that. And I think that a lot of women describe, I think, Suze was mentioning earlier about not shaving legs anymore. I mean, if we were going to all be honest in terms of our femininity and getting dressed up and things like that, I mean, that's all gone out the window apart from today. And also to be in that space, you have to feel good about yourself. And so COVID has also added this layer of just not feeling great, not feeling confident, and then, like you say, all that kind of push to get out there, you're trapped. So you can't do what you'd like to do anyway. So I think that's been a big feature of COVID.
But the good news is that women are less likely to suffer severely from COVID-19. That's
one great bit of news. The last question is, what would you say women living with HIV can do to improve their emotional well-being during this period?
I would say they should stay positive and just ignore all the misinformation going on in the whole world. They should just stick to what is the facts, what the researchers have found out, and not listen to all the misinformation they're getting.
Absolutely.
I don't know. And they should be happy.
Yes. Joe?
I think Charity just said what I would have said as far as information is concerned, because that's my deal, communicating, sharing information. But the other thing I would say is, if like me, you have really got into cooking, try and slow down on the eating, or those jogging bottoms will be the only thing that you can wear, and people will be seeing more than your top half. So
they're exposed.
Fungi?
Oh, I would say be kind to yourself, and we will get through this. And continue, if anything, continue to take your medication.
Absolutely. Finally, Vanessa.
No, and I would say also, just adding on to that, is part of being kind is also just talking to others and being open about how you feel. It is okay to have bad days. You know, when we look on Instagram and everyone looks bright and happy and learning a new skill, you don't have to do that every day. It is okay to have a duvet day, but it's also really important that if those days become overwhelming, that you do speak to those around you. And I think that's really important. Yeah.
Okay, brilliant. Okay, well, thank you so much, ladies. That's been truly inspirational, and it's wonderful to actually have a laugh with my mates as well. So thank you. So I'd like to thank my wonderful guests. I'd like to thank the long-suffering Disrupted Studios for putting up with our technical nightmares. I'd like to thank Gilead Sciences for their support with this, and all of the women living with HIV who've spoken to me about their concerns. This has been absolutely wonderful experience chatting to everyone. So thank you so much, everyone, and I hope to see you soon. Bye.
Do not forget to comment, share, like, and subscribe. And let me know if you will want us to do more videos in collaboration with AidsmapWOMEN Chat. My good friend Susan reached out to me, and I could just not say no to her. And I know you people, you love me, and you're going to watch this video because it's a video that has information. And I don't think I have done a video about HIV and women. I should do a video about HIV and women. Anyway, watch this video first, and then I'm going to come up with my own video, okay? And I wanted to tell, our storytime videos come back in September. So if you have not watched any of my storytime series videos, please go ahead and watch them. And let's meet in September in the new month. For now, bye-bye August. See you on the next one.